dementia, connecting our lives to help us survive. So we spend our time to the fullest we can.
Welcome to Professional Insights, sponsored by Dementia Action Alliance. My name is Paulan Gordon, and I am on the advisory board for DAA. I have been living with vascular dementia now for 8 years. Today, I welcome Joe Murphy to Professional Insights to discuss Medicare. Let me tell you a little bit about Ms. Murphy and the 3 programs that she directs. Joe Murphy is the Executive Director of, first of all, the Michigan Medicare Medicaid Assistance Program, also referred to as MAP, the Michigan State Health Insurance Assistance Program, referred to as SHIP, and the Senior Medicare Patrol, SMP. MAP services include, but are not limited to, providing Medicare, Medicaid, and other health benefits, counseling for older adults and for people with disabilities. MAP empowers individuals by conducting community education about their options and by assisting with applications and enrollments. Ms. Murphy provides guidance and technical assistance to MAP's local service providers to assure client services meet the standards required by all state and federal funding agencies. Ms. Murphy is actively involved in the state's Integrated Care Pilot. For 10 years prior to taking the position of Executive Director with MAP in 2007, Ms. Murphy served as a MAP coordinator covering 9 Michigan counties and the city of Grand Rapids. Additionally, she was awarded the MAP Coordinator of the Year title in 2006. Ms. Murphy has served as a certified MAP trainer for many years. In that capacity, she has conducted countless intensive training sessions for new volunteer MAP counselors and for paid staff from many human service agencies all across Michigan. MAP is a free service which is funded by grants from the U.S. and Michigan Departments of Health and Human Services, the Michigan Aging and Adult Services Agency. MAP does not receive funding, nor is it affiliated with any insurance companies. That's important. And federal grants are secured by MAP or provide monies for fighting Medicare fraud and for the enrollment of low-income individuals into public benefits program, as well as free health benefits counseling. Well, thank you so much for joining us.
Well, thank you for inviting me to join you today. I'm very excited about this.
Well, I thought maybe you could start out by just discussing what the major components of Medicare are.
Okay. Medicare has 4 parts to it. Part A, which is the hospital benefit, and that basically is the minute you're admitted into the hospital when you have Medicare, then your Part A is going to pay what benefits that Medicare covers in the hospital. That is quote unquote free, so to speak, when people are employed, as long as they've worked 10 years or 40 quarters, then they're entitled to that benefit without any charge. It used to be called FICA, which part of that goes for your Social Security and part of it goes for your Medicare. Now it looks on most people's pay stubs, it'll say Medicare or Social Security. The second part is Part B, and they call that the medical part. And that's basically anything that's not hospital inpatient. So that's your doctor, your lab test, the emergency room. And the medical benefit actually does have an amount that everyone pays. It's generally taken right out of their Social Security check before they receive it, unless you're not receiving Social Security, and then you pay that quarterly. And how that's computed every year is they take the costs from last year, see what it costs per person for everyone in Medicare for those medical benefits, and the taxpayers pay 3/4 of the cost out of the general fund, and then the Medicare beneficiaries pay 1/4. So this year, for anyone unless they're really high income, that they will be paying $144.60 per month for their Part B medical benefit. The third part of Medicare is Part C, and that's Medicare Advantage. And we're going to come back and talk about that in a few minutes. And the fourth part is Part D, or DOG, or for drugs, and that's the Medicare prescription benefit. That's the newest benefit. It actually was added to Medicare in 2006. Prior to that, everyone on Medicare had to fully pay for their own prescriptions. There was no prescription benefit coverage. So that was really a big benefit when that was added. So everyone was very excited about that. And that's a very short overview of the different parts.
Right. I know it's very complicated. It's way too complicated. When I first got involved with the Medicare process, I was overwhelmed. That was for sure. So when can people enroll in Medicare?
Okay. Generally speaking, when people turn 65, and they've worked those 10 years, so they qualify for those 40 quarters, they are first eligible to join Medicare. There are exceptions. The one exception is if someone qualifies for Social Security disability. So if they've been working and paying into Social Security, but let's say they turn 40 and maybe they've got MS and they can't work anymore, after 24 months, month 25 of receiving Social Security disability then qualifies them to get Medicare at that age, whatever age that might be. There's two other exceptions. Two groups that can get Medicare immediately are people with end-stage renal disease and people who have Lou Gehrig's disease. And end-stage renal disease, basically, usually if someone's on dialysis, let's say, and waiting for a transplant. Lou Gehrig's disease, because it's so deadly and people don't generally live very long once they're diagnosed, people receive that immediately. But for most people, generally speaking, you're eligible when you turn 65, you've worked and paid into the system, and you need to be a U.S. citizen or a quote-unquote legal resident.
Well, thank you for clarifying that a little bit. Can you share the information you have about what benefits are available to assist in paying for Medicare?
Okay, I mentioned that there was the premium that people pay for Part B, and if someone's, has limited savings, so to speak, and doesn't have a real high monthly income, it's almost $150 a month this year. And so let's say, your Social Security was $900 or $1,000 a month. That's a big portion of your income. And so there's something called a Medicare Savings Program, and you can apply for that. And then actually it's through the state Medicaid program that you apply. And then once you're approved, the state of Michigan with Medicaid dollars will pick up that Part B premium for you every month. And that's a real bonus for people. That's one of those things that our group helps people apply for. There's another benefit that for low-income people, and it's called either Extra Help or the Low-Income Subsidy. And people apply for that through Social Security. And both of these benefits are the kind of benefits that the National SHIP volunteers, all 54 programs, can help people apply for these. The low-income subsidy goes with basically the Part D, the drug benefit. And if you qualify for that, and there's different levels of it, you might get a full subsidy or a partial subsidy. It depends on your income and your savings, but it could pay your monthly premium for your drug program. It could reduce or get rid of your deductible that you have up front, and it could also reduce the amount you pay at the drugstore, your co-pays. So that, again, is a really big benefit for people. In addition to those two, those are kind of nationwide programs available to everyone that has Medicare. From area to area, I can't speak to this because it can vary from county to county within your state. It might be different from one state to the next, but there are local programs that also can fill in and help people. And those really, you need to work with someone in your local area who knows those programs. It just varies depending on where you live.
Okay. Well, thank you very much. That's a tremendous benefit to be aware of.
Yeah, it can make a big difference to people. It really does.
Okay, and how about we move on to the Medigap and the Advantage Plan, those two mysterious entities.
Okay, I had mentioned the Advantage plans, which are Part C of Medicare. And these really primarily started when they added the prescription drug benefit to Medicare. And because they wanted people to have choices, they determined that people could get their Medicare benefits through a private insurance company. And so what that means is basically it's like a managed care organization. And so Medicare pays a private insurance company so much per month per person to provide the Medicare benefits to someone. And so there's a multitude of those programs that people can choose from. And I'm going to give just an example. I live in the Grand Rapids area here in Michigan, and one insurance company in that area, they happen to be called Priority Health, is one company, but they have 6 different Medicare Advantage plans. And each Advantage plan has a little different, you get the same benefits because they're required to give you all the benefits Medicare gives you. But what your copay basically is for those benefits varies by the plan that you purchase. So the plans, have different costs depending on which one you pick. And then the other little caveat is they also usually are by regions, and they might be a county or 3 counties or some kind of jurisdiction. And so the price will vary by where you live. So there's a county just north of Grand Rapids, and people who live in this one little city called Greenville, if they live on one side of the street, they pay a certain amount. And if they live on the other side of the street, they pay a different amount, but they quote unquote have the same plan. So they get the same benefits with that particular plan, but the amount they're going to pay for their premium is going to vary by where they live. So, we're saying this is complicated. There's a multitude of factors that make it complicated. People often get Medigap or supplemental insurance and Medicare Advantage confused because Medigap or supplemental insurance is also sold through private insurance companies. And the one that I'll just mention, because probably people are most used to seeing the ads, is AARP has the United Healthcare Medigap or supplemental insurance plans, and you see the girl on the big bulldozer going through the maze trying to figure it out, helping people. And those are private plans. There's lots of companies that sell them. And what happens with those is for people who have original Medicare, the A and the B, the hospital and the medical, not Advantage, your A and B will pay first, and then there's some deductible coinsurance or copay left over that Medicare doesn't pay, and you can buy this private insurance that then picks up that additional amount. So either you pay it, it's usually like with the Part B benefit, it's an 80-20. So Medicare pays 80% and then you owe 20%. So you either pay the 20% of the cost or you buy a private insurance plan that picks that up for you. So if you have original Medicare A and B and you buy supplemental insurance, you may have no other out-of-pocket medical costs, but you will still have your Part D, your prescription drug plan cost, and your copays for drugs. However, if you have that Advantage plan, you may have one monthly premium, but you're going to have, depending on the plan, for all of your services, you're going to have some kind of copay. You may have a deductible up front, and then you'll have a copay for your regular doctor, one for a specialist, one at the lab, one for your emergency room, one for your ambulance. And there's no private insurance that you can buy to pick up those costs. You pick those up yourself. So generally, your monthly premium is going to be a little lower, but you're going to have out-of-pocket costs. There is one good benefit with the Advantage plans. They now have a cap on them, and it varies from plan to plan also, but it could be somewhere between, let's say, $5,000 and $7,500, somewhere in that range per year. So once all of your medical copays reach that amount, then for the rest of the year, you wouldn't have any more medical copays. You would still have your prescription copays. So when you're looking at, let's say, 30 different Medicare Advantage plans, you're looking at original Medicare with maybe 30 different supplemental insurance plans, plus the fact that all of the prescription drug plans have different formularies or drug lists. You need to find the plan that covers the drugs you take. And then you want to find the plan that not only covers your drugs, but has the drugs at the best price. And each plan gets to determine what the price of the drugs are. And then in addition to that, depending on where you purchase them, so let's say whether you purchase them at Walgreens or CVS or the mom and pop pharmacy or mail order, that's going to affect the price. There's a lot of moving parts that you need to pay attention to save money. And that is what's so wonderful about the SHIP programs, is that by sitting down and working with people, we can narrow the options, because research shows if anyone has usually more than 8 choices, they don't do anything. They become immobilized. And so generally we narrow it down maybe to like 3, or if they don't know if they want a prescription drug plan or an Advantage plan, maybe 3 of each one. So a maximum of 6 that would probably meet their needs and be the most affordable. And then we would explain the differences. So one plan might have a lower monthly premium, but it would have a higher deductible. Mm-hmm. Okay, or another one's going to have a high monthly premium, but maybe no deductible. And those kinds of things really come down to people's personal choice, how they want to spend their money to cover their health care. And it's our job not to make a decision for you. Someone's always saying, well, if I was your mom, what would you? No, I'm sorry, I can't do that. Let me explain it again. We want to educate people so that they can make a decision about what's best for them. But we want to make that elephant in a number of bites that makes it manageable so you can make that decision. So you can see, okay, first I need to understand what the parts and pieces of Medicare are. Do I qualify for any low income help? Okay, now I got a kind of an idea about that. Well, now do I want original Medicare with supplemental insurance or Medigap, or am I going to go with an Advantage plan? So that's just a lot to get your feet on the ground in front of you to start making a decision.
Can you talk a little bit more about CHIP services and where to locate them and who's eligible?
Okay, yes, if you go online, and I think somewhere you will have this
Yes.
available for people. I'm not quite sure how it works. Actually, there are 54 SHIP programs, so all 50 states, District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands have SHIP programs. And if you go to the shiptacenter.org, you can find there's a locator there, and you can connect and find the SHIP that serves the area where you are. And the other thing that, of course, makes things complicated, as you mentioned, in Michigan, we call our program MAP, or the Michigan Medicare Medicaid Assistance Program. In Florida, they call their SHIP program SHINE. In Ohio, it's called OSHIP for Ohio SHIP. So the animal has a lot of names. It's ice cream, but it's chocolate, vanilla, and strawberry.
So shiptacenter.org is the place to go.
Yeah, shiptacenter.org, yes.
Okay. We will put a link to that in the video. And then the next question I wanted to ask you about was about businesses that conduct Medicare seminars. Are they biased in any way?
Well, I hope not, but unfortunately, generally speaking, businesses that offer educational seminars or offer to help you find a Medicare plan may generally the way they receive their money is when they help someone enroll in a plan, they will get a commission from that company. So whatever the company is, whichever plan you buy, there will be some kind of financial incentive. And so that's how they can afford to help people. So often they have a certain group of companies they'll work with. And so they may not look at, the 30 plans of lists and the 30 plans of that. And that's why the SHIPs are so great, because we receive federal grant dollars, which basically are tax dollars. We don't save a lot of money because it's funded to be a volunteer program. That's why we train people to help. And most of them are true volunteers who get a lot of training and a lot of mentoring and a lot of supervision, so that we don't really have any financial incentive at all, because we're just there to help people, and our program's not going to be dependent on someone enrolling or not enrolling or which plan they enroll in. Our incentive really is to save people money, because one of the things we do, like all nonprofits, is we go out and brag about helping people, because we hope Congress will fund us again next year. And one of the things that we let Congress and everyone know is, last year we saved people in Michigan, $250 million. Well, how did we do that? It was by helping them get the best plan for them. And I always ask my volunteers to send success stories so I can tell those nice stories to people. But they're so excited. Today I saved this lady $2,000. If she had stayed with the prescription drug plan she had last year, it would have cost her $12,000 for her drugs for next year. but because we were able to find a better plan for her or sign her up for low benefits or both, now her drug costs for next year will only be $2,000 instead of $12,000.
Wow.
And you would be amazed how quickly that money adds up. And the other good thing is because, you know, the people we help are really, really wealthy, and that money goes right back into the local community. It gets spent at the grocery store or somewhere else in the local community, helping local economies, and making people's lives less stressful and more comfortable. So that's our incentive. And then to our, you know, we don't have big money for marketing, so we want all of the people we help to tell their friends and neighbors, because that's how we get more people to help. So yes, I would actually recommend going to a SHIP program and getting help. It will be in people's best interest to do that. And we have good training. We have backup from federal agencies that we work with to make sure that people are getting accurate information. And if something goes wrong, because, you know, when computers talk to each other, something's bound to go wrong. We have the connections, the people we need to talk to get those things fixed. Generally speaking, if someone selling insurance sells you a policy, that's really great. But when your hospital bill doesn't get paid, they're probably not going to be your advocate, and they're not going to talk to the billing clerk and all of those kinds of things that our counselors will do for you.
That sounds wonderful. Can you just close by summarizing the internet sites that you would recommend?
Okay, for people who use the internet, they're pretty savvy. They love to do research. All of those options I was telling you about, actually, the information is out there. We, you know, train our people to use the tool. It's called the Medicare Plan Finder. So if people go to www.medicare.gov, they can scroll down to an icon on the front page. It kind of looks like a purse or a bag in the lower right-hand corner. And it says Find 2020 Health and Drug Plans. And you can click right on that icon to do your own comparison and see which plans have your drugs and what the costs might be, and begin that search. But, you know, we want to educate people how to do that for themselves if they'd like to do that, or if they get lost in all the various clicks they need to make here and there, they do have someone to call. But the thing I want to remind people is when they're on that website, that every company has a different drug list and all the drug prices are different. So, and like I said, it varies by the plan and by the pharmacy and all of those other things. So there's help for people out there. And we really encourage people every year during open enrollment from October 15th through December 7th to quote unquote go out and shop, because the plan you had last year might have been great, but that plan may be changing for next year. And you'll get a letter and it'll say there's some changes and it'll tell you what your new monthly premium is. But if you don't really look, your drugs might not even be covered by that plan next year. So you have until December 7th every year to select a plan that will start in January. Or if you're new to Medicare during the course of the year, you know, that's the time you can also shop. But we strongly, you can, if you don't do anything, you'll just roll over in the same plan you had. And people are tempted to do that because it's easier. But we strongly encourage people to do that shopping every year because it's going to make a big difference in what their healthcare costs are.
Well, thank you so much for taking time out of your busy day to join us. You are just been a wealth of information. It's a complicated topic, that's for sure, and you've really helped to clarify a lot of facts. So thank you very much.
Well, thank you for inviting me. This was wonderful.
Good. Glad you enjoyed it. And to our audience, if you enjoyed today's interview, please subscribe to DAA's YouTube channel to receive all of our interviews, and do consider making a tax-deductible donation to our charity at daanow.org. Thank you so much.
We're living beyond dementia, connecting our lives to help us survive, so we spend